face from Himalaya Wellness Company. It is indeed a moment of immense pleasure to welcome you all scientific services from Himalaya Wellness Company. It is indeed a moment of immense pleasure to welcome all our beloved doctors and respected doctors and beloved and respected doctors who are on board. On behalf of the Himalaya Wellness Company, I take this opportunity to extend my earnest regard and greetings to the eminent guest speaker, Dr. Rajendra Punjabi sir. Though virtually, let us all together light the lamp as a sign of keeping the flames of wellness and happiness alive. As you know, doctors, wellness in every home and happiness in every heart has been our vision since 1930. With your constant support and patronage, we have successfully completed 92 years of your trust and service in this field. During these years, we have been in constant connect with our beloved doctors through various means. This is another modest attempt from our side to recognize this online event with eminent guest speaker on occasion of World Kidney Day to spread the awareness on kidney health. Doctors, today we have eminent guest speaker, Dr. Rajendra Punjabi sir, and it's my honor and privilege to introduce him. Dr. Rajendra Punjabi sir, born and brought up in Indore. He did his MBBS in 1976 and MS in 1980 from MGM Medical College, Indore. Dr. Rajendra Punjabi sir worked in the prestigious Institute of India, that is Bombay Hospital, Mumbai, and thereafter served in Iran as consultant surgeon till 1986. His experience constitutes of work in famous institutes of England, USA, and Canada. His experience has taken him to different. What rings most about him is his compassionate care for the honest well-being of all his patients, which has also led him to be the recipient of the famous Guinness Book of World Record for a rare surgery done by him. This surgery was removal of 650-gram prostate gland, which is a rare entity. When not working, he loves trekking and has been to Everest Base Camp and Annapurna Base Camp. He is also a wonderful singer and fitness enthusiast. Warm welcome to you, sir. Everyone, stay tuned. Over to you, sir.
Good evening, friends. Friends, 9th March was World Kidney Day, which comes second Thursday of every March every year. And today is 13th and we are discussing on kidney. Friends, as you all know, that after the heart, kidney is the most important organ of our body. And we had to really take care of our body and kidney. Today we are discussing about recurrent renal calculi and its impact on our health. Friends, as we know, when there is crystal aggregation, that is urolithiasis, and that starts giving severe pain in our lumbar region. So we always call it pain from loin to groin. And as we are seeing in the picture that this is the place of our kidney, and if any time crystals deposit over there, it obstructs our kidney. And because of obstruction, one gets severe pain. Every kidney makes about, say, 1 liter of urine per day. And if even a small particle obstructs it, it is going to get blocked and get ballooned up. So that's the reason patient gets pain. Now, in our Indian population, about 12% of our population suffers from the stone problem. And many of them, they end up in the loss of kidney function. This is more common in the middle age, more in the men, and even in the post-menopausal women, it's equally then common. Particularly, it's more common in India, in the Madhya Pradesh, Rajasthan, Gujarat, Maharashtra, the places which are more hot. So almost 10% of in recurrence, if we see, every year 10% of patients will recur their stones. So every year, the first year it may be 15%, and second year it may become 35, 40%. इसको नीचे कर सकते हैं, ये वाला यहाँ पे आपको पूरी स्लाइड में. So whenever disturbances in the colloid and crystalloid balance, person starts getting stones. अगर सिंपल लैंग्वेज में कहेंगे कि जब शरीर में पानी की कमी हो जाती है, the crystals start forming. And if somebody is lucky, if the small crystals come into the ureter, patient gets pain and the patient may pass out the stone. If sometimes stones gets deposited into the kidney, the stone may become this big even without symptoms, because this may lie in the kidney pelvis and it allows urine to go down. When it allows urine to go down, patient may not feel pain. But if a very small stone also blocks ureter, person will get severe pain. So whenever there is disturbance in the colloid crystalloid, then whenever there is metabolic disturbance, when there is infection because of the bacteria, chronic UTI also may increase chances of stone formation. Now, as we know, there are a variety of stones. Most common are calcium oxalate, calcium phosphate, and these calcium oxalate are radio-opaque stones. We are able to see very well in our X-rays also, while uric acid may not be visible in the X-ray. So almost 70 to 80% stones are calcium oxalate stones. Now again, there are different types of stone. As we discussed, 75% are calcium containing. Another 15% are called triple phosphate stones. Only 6% may be uric acid stone, which are radiolucent, and 1 to 2% are made up of cystine stones. These are about struvite stones, which are mostly more common in the women, and the stones can grow to up to even a large size to fill up the renal calyces and to make a staghorn. Staghorns are like this. So this is one of the very big staghorn stone. And this is a, say, calcium monohydrate stone, very hard one. Now, as we are discussing about the symptoms, obstruction with the dilatation, that gives rise to stretching the upper ureter and in the renal pallidus. This spasm leading to severe episodic pain and dysuria. Person will start getting difficult in the passing urine. He may start having some blood in the urination. He may start vomiting, nausea and vomiting. And it's a pain sometimes is more severe than the heart pain. And the contributing factors may be urine volume. When urine volume is low, changes in the urinary pH, increased concentration of stone concentration, that increases supersaturation, infection, as we discussed. So it's all disturbance between crystalloid and colloid level. So urinary saturation, supersaturation, nucleation of the crystals, then crystal growth, crystal aggregation, crystal retention, and then stone formation. So this is the sequence of events in the formation of any urinary stone. Now here we are seeing about the size aggregation of calcium oxalates in crystals in urine. Now what are complications of recurrent calculi? Apart from causing symptoms such as pain, vomiting, blood in urine, kidney stones can cause serious medical complications like severe infections including septicemia, which can be life-threatening, renal scarring and damage to kidneys resulting in permanent renal failure, loss of function of a kidney is a need for sometimes removal of kidney. When a kidney patient gets pyonephrosis after hydronephrine, if we don't remove stone in time, person will get pyonephrosis. Kidney will become full of pus. In that case, we had to remove kidney sometimes. And sometimes bladder blockage can result when a large kidney stone has managed. One of the biggest stone which I have removed from the bladder is this size, which I removed 40 years back in Iran when I was working over there. And this stone I brought from Iran as memory. So this is one of the probably biggest stone which I have seen and I removed. Now, what are the investigation? So routine urine examination is very important. So in that we'll find presence of blood and pus, sometimes RBCs, pulses and cast. Blood biochemistry, urea, creatinine checkup is very important. After that, the most important investigation is ultrasonography. In ultrasonography, we are able to see how are the kidneys, how big is the stone, and that we get confirmed by X-ray KUB. X-ray KUB means kidney, urethral, and bladder. If the stones are 5-6 millimeter, then X-ray and sonography is enough. But if we find that the stone is more than 8 millimeter, 10 millimeter, which may require some procedure for removal, then we require intravenous pyelography and sometimes CT scan, especially CT Euro, which will cover all the kidney, urethral, bladder. Sometimes we require endoscopy, cystoscopy, and ureteroscopy. In some rare cases, we require even parathermal estimation. Now, what's the management? So it all depends on the location of a stone and extent of obstruction, how much function is affected, and what about unaffected kidney, how good it is functioning, presence or absence of UTI, progress of stone passage. If we observe some small stone that in few days, 2-3 days, it has already traveled down, then we hope that it may come out. Risks of operation or anesthesia, the medical fitness is very important. So ultimately, severe obstruction, infection, intractable pain, serious bleeding indication for removal of a stone. Now, what's the medical management? Now, as we know, because of the lack of water, stone forms. So the most important thing is the hydration. Composition of kidney stone should be determined. Even when the small stones pass out, we have to get the chemical analysis of a stone. Now, whatever is the etiology, every patient should be counseled to avoid dehydration and to drink sufficient water. But one thing I have observed in my practice, if there is uritic colic, already one kidney is obstructed, that time a patient drinks more water, so he will get nausea and vomiting. So I tell patient once, if you are getting pain, that time you reduce your water intake. And once a stone comes into the bladder, then pain will go away. Then patient can drink as much water as he likes. So at least one should make about 2 liters of urine, and it prevents us in the recurrence of the stone also. So we ask every patient that you must drink that much water every day that you may at least 2.5 liters of urine. It may not be only water, it may be pani, it may be starch, it may be some juices, coconut water. Because the person says, I can't drink so much water. We can ask them to even have green tea. So somehow water intake, liquids, high liquids will help him. Now the size is important. If it is 5, 7, up to 8 millimeter, there are chances that the stone may pass out. But if the size is more than 10 millimeter, he may require lithotripsy. So lithotripsy, which started almost about 35, 40 years back, when first time I had gone to Canada, that time lithotripsy had just started over there. When the patient used to put in a tub of water, and that time this radiation will help him to break the stone inside and make it small particles. And other medical management, we have got alpha blockers, calcium channel blockers. Then if the stone is more than 10, 15 millimeter, the most common procedure these days is PCNL, percutaneous nephrolithotomy. In PCNL also it's more common now, mini PCNL. Now initially when we used to do PCNL, we used to make a big bore incision here. But now a small instrument, that is mini PCNL, can break the stone. Then it is ureteroscopy, RIRS, and sometimes still when the stones are really big inside, he may require even open surgery. So ESWL is shock wave therapy. It is stone with ultrasonic shock pulses into the small particles. It may be electromagnetic, much requires sometimes small stone. One sitting is enough. That takes about 35 to 40 minutes. It breaks into pieces, and sometimes if we suspect that the stone may obstruct kidney, then we put a stent also. That's called DJ stent. So once the stent is there, particles won't obstruct and patient won't get severe pain. So this is all about ESWL, how the rays are reflected. And this started, in fact, when the birds used to hit the aeroplanes. This is how ESWL was invented. Now here in this picture, we are seeing stents in both the sides because their stones are in both the kidneys. And if the stones would have not been there, kidney would have become really hydronephrotic. So whenever we are suspecting some residual fragments, stents before surgery should be put. And once there is 100% clearance of the stones, we remove the stent, local anesthesia as a day care. In 3-4 hours time, patient goes home. Now this is about PCNL. Before PCNL, IVP or CT Euro is very important to understand from where to puncture the kidney. So which is the shortest route to reach the stone. And once we are inside the kidney, we break the stone either by laser or by lithoclast into small pieces. And all the particles are taken out there only. That time after doing procedure, we sometimes put the stent also, which is removed after 2 weeks. This is the instrument of PCNL. Again, this is the CT Euro, which is showing even the vasculature of kidneys also, about the renal artery and all the. So this is really gold standard these days, CT Euro and the PCNL. This is about the RIRS. Now this is an instrument which travels into the kidney like a snake, and it can visit different areas of kidney inside. This is really state-of-art technology. After PCNL, probably RIRS is the most common procedure which these days urologists are doing. So it goes inside, and again by laser we break it into small pieces, rather like a dust, And after doing the procedure, we put a stent, and all dust comes out along the stent. So this is the instrument RIRS. So there are these days even disposable instruments have also come, which we use for maybe only a few cases. This is how we are seeing that RA tip is in the pelvis and breaking the stone into small particles. RA is into the upper calyx, middle calyx, lower calyx, doing the job into different parts of the kidney. This is about the URS. So this is a semi-rigid instrument. Before RIRS, URS, ureteroscopy, has been the most common instrument. This is a stiff instrument which goes up a urethra penis into the ureter, and from the lower ureter, middle ureter, or upper ureter, we break stone into the small particles. And simultaneously, we look on the CT scan also, that has it broken nicely. Once we see that all the job is done, we put a stent and come out. So by doing URS, you require a wide ureter. Sometimes you have to put a stent before 15 days to make it wider in for URS or for RIRS. Now these are the different type of stone breaking mechanisms. Lithoclast has been most common, which is called pneumatic vibrator. It's completely cheaper machine, works a lot, even large fragments can be broken, good for PCNL and URS. These are other mechanisms like laser, very thin fiber, holmium laser, which goes inside and make the dust of the stone. During that time, we require good flow of water during the procedure because it produces some heat also at the tip. And there is excellent stone breaking capacity, thin fiber suitable for RIRS, but no doubt lasers are a little bit expensive. This is the laser machine, mostly holmium laser. The 80 hertz are used for mostly prostate surgery. For stone, 20 hertz is also enough. And it's a high power machine for good fragmentation. Low power machines are slower and time consuming, require fixed temperature in OT and very high electrical power. This is another laser, advanced laser, thulium fiber laser, which has got better breakage, 4 times more faster than the holmium. So what complications we may face? Because of the lasers, and EHW also produces some injury to the kidney, so we have to be careful. It may give rise to some bleeding, subcapsular bleeding, sometimes hematoma formation, so it affects the function of the kidney. Ureteral stents may cause minimal to moderate discomfort. That's called stent syndrome. So we have to give some medication to avoid that problem also. Now, foodstuffs of high calcium we have to avoid for prevention of stones. Like milk can be taken in some limited amount. Curds, yogurt, creams, soft cheese, they should be avoided. Foodstuffs with high oxalate, like these cashew nuts, beetroot, these are the causing because of the high oxalates, and there are more chances of calcium oxalate stones. Foodstuffs with high phosphate, beans, soft cheese, even in non-vegetarians, they have to avoid liver food also. Nuts with high urate. Intake of urate should not be more than 500 milligram per day. Like called, so again, non-vegetarian. So we suggest patient, all the non-vegetarian patient, when I was in Iran, my every second patient used to have a stone problem because being a hot area and they take a lot of non-veg food. So I always tell them, okay, you can become shakari also. So it's better for you. And avoiding factors for recurrence like purine-rich food, vitamin C after oxidation, vitamin D for long-term overdose can be helpful. prolonged recombination decalcification of bones can occur, so some calcium is really necessary. Alcohol may induce some gout also. Patients ask us, sir, can we take the beer for the removal of stones? What we feel that previously the beer used to be 2%, 2.5%, but these days people are taking beer also for hangover, having 8 to 10% of alcohol. So we suggest them that even beer should be avoided. Better to have coconut water and charge and simple plain water. So other things which we have to avoid, the urinary infection has to be really avoided. Bacteria urine culture should be done and accordingly antibiotics should be given. So friends, thank you very much. And if you have any questions, I'll be very happy to answer. Yeah, Dr. Naveen?
Yes, sir. Thank you very much, sir, for really a wonderful lecture. It was indeed a feast of knowledge. I hope everyone has enjoyed the session, and I'm sure there are a lot of questions also from the participants. So before moving to the question and answer session, as you all know that this webinar has been brought to you by the makers of Cystone1. So I would like to invite my colleague, Dr. Samir Chauhan from Ahmedabad, to deliver a lecture, a short presentation on Cystone1. In between, I would request all the participants to please put your questions in the chat box. Over to you, Dr. Samir.
Thank you, Dr. Naveen. Is it visible?
Yes, Dr. Samir, it's visible.
Thank you. Thank you, Dr. Naveen. So, namaste. Once again, very good evening to all. And once again, greetings from Himalaya. On occasion of World Kidney Day, with the theme, Kidney Health for All, Himalaya has organized this online talk by Dr. Punjabi. And, this talk is actually just to spread the awareness related to the kidney health. And as you all know, doctors, that Himalaya is being pioneer in this management of urolithiasis through our product for the management of urolithiasis. So doctors, as you all know that there are some medicinal plants which are well documented for its role in the management of urolithiasis in the classical reference of Ayurveda, such as the Dimmocarpus pedicellata, which provides anti-lithiatic action through inhibiting the deposition, accumulation, and supersaturation of the calculogenic material. Then the second herb, which is Rubia cordifolia, which provides anti-lithiatic action. And what already our honorable speaker has mentioned, that the most common type of urolithiasis or renal calculi is calcium oxalate. And what we have observed in our clinical trials, that hydroalcoholic extract of Rubia cordifolia reduces the calcium, oxalate, and phosphate levels in urine. It further dissolves the oxalate stones. Further, Saxifraga lingulata, which provides the lithotriptic action by dissolving the mucin, which binds the stone particles. Further, Cyprus caryopsis and Ocimum basilicus, which together these two herbs provide anti-inflammatory action. So it further soothes the inflamed tissues and prevent the impaction and thus prevent the anti-inflammatory action. Further, Acheranthus aspera and Tribulus terrestris. Together, these two herbs provides diuretic action by increasing the GFR rate. So doctors, all these ingredients we have added in our brand, Cystone1. You all know the journey we have begun in the 1943 by launching Cystone for the management of urolithiasis. Then in 2008, we have launched Cystone syrup for the management of UTI. And it is also proven by US FDA radiolabel biotech assay that it further prevents but inhibits the bacterial adhesion to the uroepithelium. And our quest to provide the effective solutions, doctors, we have launched Cystone4 tablets. And all these ingredients we have discussed are added in Cystone4. So here is the complete spectrum you can see here of the stone formation. So in this, pathophysiology, actually patient come with us at the end stage with the confirmed diagnosis of stone. But what our honorable speaker has already mentioned, that the prevalence rate of recurrence is very high in MP, Gujarat, Maharashtra, and Rajasthan. So even you can see here at the very early stage, like nucleation and crystal growth, our Cystone4 works. So at the very beginning stage, Cystone4 corrects the crystalloid colloid imbalance, which is a very important factor for the stone formation, what our speaker has already mentioned. It further renormalizes the urinary pH, acts on the mucin, and further exerts the antibacterial action. At this stage of inflammation and impaction, it soothes the inflamed tissues and prevents the implantation. And at the end stage, Cystone4 dissolves the mucin, which binds the stone particle, and further flushes the stone gravels by promoting diuresis action. It further exerts the spasmolytic action to enable the smooth expulsion. So doctors, as you all know that each of the product of company Himalaya is launched after extensive research. And here I would like to mention 1 or 2 clinical trials on Cystone4. So one of the important trial, which was carried out by Dr. Jaya Raman, MCH Urology, which is also published in Journal of Urology and Research, to evaluate the safety and efficacy of the Cystone4 in the management of urolithiasis. So here you can see the results. We have enrolled 30 patients for the size, calculi size 7 to 12 mm, and out of 30 patients, 16 patients got complete expulsion. And for the size of 5 to 6.9 mm stone, we have enrolled 35 patients, and out of 35, 20 patients got complete cure. So in the rest of the patients, we have observed reduction in the stone size. Even we have observed significant improvement in the clinical in the symptoms related to the urolithiasis, like colicky pain, abdominal pain, dysuria, pain on micturition, hematuria, nausea, vomiting, fever and chill, and loss of appetite. So the conclusion of the trial, we have observed that Cystone4 is safe and effective in the management of urolithiasis with significant improvement in clinical symptoms. Further, it expels or reduces the bigger stone size ranging from 7 to 12 mm. Another trial, comparative study with tamsulosin, and in this trial, we have observed that comparable results with the significant improvement of clinical parameters even compared with the tamsulosin. So the indications for the Cystone4 doctors, urolithiasis, stone size up to 12 mm, and crystalluria. Further, to manage the post-lithotripsy complications and recurrent wounds. So the dosage in urolithiasis and crystalluria, 2 tablets BD till stone passed out or till symptoms subside. And for the post-lithotripsy urolithiasis, 2 tablets BD for a period of 6 weeks. So please ensure the duration of therapy minimum 6 weeks. So that's all for the Cystone4. Thank you so much for patience listening. Over to you, Dr. Naveen.
Thank you very much, Dr. Samir. Thanks a lot for giving a short presentation on Cystone4. Now, doctors, it's a time for the question and answer session. Dr. Punjabi sir is also waiting for the questions. Sir, there are a lot of questions I have. Starting with Dr. Rahil, who is from Ahmedabad, and he wants to ask that how many maximum stone can be removed in a single operation?
Yeah. So depending now, if you are doing lithotripsy normally targets one stone at a time. It's about 10 millimeter. And in PCL, sometimes we have to do one puncture, sometimes more punctures. So depending that where I want that we decide on the X-ray and on CT Euro. And as I have made my Guinness World Record for my largest prostate gland, one of my friends has made a Guinness World Record for removing largest number of the stones.
Okay.
He removed more than 1,000 stones from one kidney. So sometimes because of the big number of stones, may require even to do open surgery so that things are faster and we can remove stones in a one go.
Thank you very much, sir. Thanks. Yes, sir. Thank you. So another question is site of the stone. Sir, we always discuss about. Normally, we have discuss about the size of the stone, but site of the stone is also important, as you have already mentioned in your presentation. Yeah. So, which are the common sites for the recurrence of the stones are in urinary tract, which are difficult?
See, size is very important. Even when we give treatment, we look for the size of the stone. If you see, the lower end of the ureter is around 4 to 5 millimeter of stone. So we hope that with our conservative treatment, 4 to 5 millimeter stones will pass out. And with some medication, we can hope that even 8 to 9 millimeter, in some of my patients, even 10 to 12 millimeter size of stones have passed. And for the recurrence also, now once a patient has passed out a stone, we should do chemical analysis of stone, and then we give them a diet chart. Besides telling them that they have to have plenty of liquids, we give them diet chart that these are the things one should avoid, and these are the things one should have more rather. Like if somebody is having stone, we tell them to have more liquids, he can have more bananas, somehow to increase their urination. So, and in their food, the oxalate should be minimum. If somebody is having uric acid stone, then protein has to be controlled. So this is how we can prevent, and the person has to be very active. We tell them you have to change your lifestyle also. So here also there is role of lifestyle management. We tell the patients of our cardiac patients about their lifestyle management. So here also for stone patients, that stands true. That here also they have to go for walk, they should start doing yoga, they should do cycling, even swimming. So an active life and a healthy lifestyle will have prevention of recurrence of stones.
Thank you very much, sir. And you are a role model for the fitness, sir.
Everybody should be really looking after health. I tell everybody that God has given us life of more than 100 years, but with our poor lifestyle, we reduce it. If we really want to live very healthy, we have to take care of our lifestyle and enjoy everything. I tell my patient, if you are going for a walk, don't go in majburi. You should enjoy your walk, you should enjoy your yoga, then only it is going to help you more. कि आधे करेंगे तो वो मजा नहीं आएगा जो दिन करने में आएगा. Right, Naveen?
Yes, sir. Thank you, sir. Another question is sir, nowadays we have seen uric acid stones are very common nowadays. So one reason I think you have already mentioned more
high protein diet, as we talked about the non-vegetarian food also.
Yes.
Many patients says we don't get thirsty. I tell them, even if you don't get thirsty, you should go for urination every 2 hours. If you don't have urge to pass urine every 2 hours, it means there is lack of water in your body. So I tell them to keep a bottle with you in your hand. and keep on taking some sips every few minutes also, and then 1.5 to 2 hours. तो उससे क्या होगा कि जो छोटे छोटे क्रिस्टल डिपॉजिट नहीं होंगे. आई टेल पेशेंट कि भाई किसी का स्टोन एक दिन में नहीं बनता है, छोटे छोटे पार्टिकल्स मिलके ही स्टोन बनाते हैं. एंड इफ यू कीप ऑन टेकिंग गुड लिक्विड्स, तो वो पार्टिकल्स को मिलने का मौका ही नहीं मिलता है, एंड दे पास आउट लाइक दैट. और नहीं तो अंदर इकट्ठे हो जाएंगे. या नवीन?
Sir, there is one question about vitamin C, sir. We have seen that like vitamin C is also helping in the management. So,
yeah,
what's the role of vitamin C also, sir?
Yeah, definitely. Vitamin C, usme crystallization, it helps in so that crystallization doesn't happen. And otherwise also, calcium, this vitamin C is boosting our immunity also. It prevents us from many, even, URI and UTI and all. So one should have more vitamin C in our food also, in form of, say, orange juice and even Nimbu Pani. So this is always good. One should add vitamin C also.
There is another question. I think many of the doctors are asking one very common question. This is, sir, regarding Himalaya, Cystone. So the question is like Cystone tablet, and what is the difference between Cystone tablet and Cystone 4 tablet? So, sir, do you want to answer, or I should?
I think if you are
Sure. Thank you, sir. So, doctors, like Cystone tablet and Cystone 4 tablet, both are having the same ingredients, but Cystone 4 is having a higher concentration of the same ingredients. It's a 1.5 times higher concentration of the ingredients. So we recommend Cystone 4 in the bigger size stones up to 12 mm. And there is another question, sir, like up to 20 mm, what should we do? so
if the stone is big, once it is 20 mm, the best thing will be mini PCNL. So in the one go, the whole stone will be out. So for the 20 mm, then Cystone will help you out. Once the stent is there, it will help you out in the prevention of the stone. But once you come 20 mm, then it does require some operative procedure. It may be RIRS also or PCNL.
Yes, sir. Sir, one more question, like regarding vitamin D also, sir. Vitamin D, many literatures are showing like vitamin D is overuse of vitamin D is not good for the.
That's right.
Yes.
Vitamin D is no doubt good for to make our bones strong, but definitely anything in excess harms also our body. And we are lucky in India having good sunlight. So already the source of vitamin D is with us, unlike many Western countries where you don't see sun for many days. So we are lucky that if we go for a 20 minutes walk in the morning in sunlight, then that may complete the requirement of our vitamin D. So if we feel that somebody is having lack of vitamin R, if somebody's vitamin D estimation is showing that it is lacking vitamin D, otherwise he may not require really additional vitamin D in his food.
Okay. And the last question regarding, sir, black tea. Nowadays, black tea is also very common, like people are using black tea. So we
talk of green tea also and black tea also. So rather these days there is more fashion of green tea, and green tea comes, even they say green tea helps in obesity also. So green tea comes in the tulsi and in many flavors, in adrak flavor, tulsi flavor. And that is a green tea is a good otherwise. So in that case, they can buy routine milk tea. They can avoid the milk also. And green tea will give more urination. It helps to increase the immunity also. So green tea will be better. And because these days fashion of black coffee and black tea. Black tea may be just minus milk may become black tea. but I will insist more for the green tea. That will be more useful.
Sir, last question. Which stones are you feel are more difficult to treat renal calculus, like kidney stones or ureter stones?
No, it's all the size of the stone. Many times ureteric stones are easier to, because either they may pass out with the medication, or if they are bigger in the size, we can do ureteroscopy or RIRS. So, but if the stones are big in the size in the kidney, so kidney stones will be more difficult to treat, because then you have to puncture the kidney. You have to make a hole in the kidney. And kidney is full of blood vessels. So there is biggest risk of bleeding when you are treating big stones in the kidney. Because sometimes puncturing the kidney, many patients may get a lot of bleeding. They may require blood transfusions also. And sometimes even nephrectomy is required, because if there is a lot of bleeding and if we can't control bleeding after surgery. So,
thank you very much, sir.
Stones in the ureter and in the bladder are easier to treat compared to kidney stones.
Okay. So thank you very much, sir. Almost we have taken all the questions. Now, sir, your final concluding remark for the participants.
Yeah, my final remark is this, that as everybody should keep on drinking water. If it is a summer, then maybe water intake maybe 3.5 to 4 liters liquids, so that at least 2.5 liters. Many patients, when I ask them that how many times do you, they say 2 or 3 times. So if they don't go for urination, it means they are not taking enough water. If somebody's formed stones and we want to prevent recurrence, I tell them even in the night time you take more water. No harm if you get up in a day 2 or 3 times in the night also. So healthy lifestyle, plenty of liquids, and as we discussed about the food, what to be avoided, that will definitely prevent the recurrence also. So what we have talked that in about 5 years, 50% stone patient recur the stones, then we can prevent probably those patients also from the recurrence. And that is really our aim of today's topic, so how to prevent the recurrence. So healthy lifestyle, always a water bottle in your hand, keep on passing urine every 2 hours. And if there are some associated problems like prostate problem, some congenital problems, we should take care of those things also. Thank you, Naveen.
Thank you, sir. Now it's a time of vote of thanks. As William Arthur Ward rightly said, that feeling gratitude and not expressing it is like wrapping a present and not giving it. On behalf of Team Himalaya, I would like to thank Dr. Rajendra Punjabi sir. Thank you very much, sir, for your gracious presence and for being the speaker of the session. Special thanks to all the doctors on board for your valuable presence, support, and patronage. On behalf of the team Scientific Services, let me thank all Himalayans who joined hands together to organize this event. My deepest sense of gratitude and appreciation to all those who made this event a resounding success. Once again, thank you all. Jai Hind. Namaste.